All right, so we've talked a lot at this point about what navicular disease is, and I mentioned in, I think, both of the videos that it's commonly misdiagnosed. So if it's commonly misdiagnosed, there must be other things that present as navicular disease, right? So if we're looking at kind of the most common things that will get mislabeled as navicular disease, I just have a quick slideshow here to go through with you guys. So the first one is just contracted heels in general. This can cause heel pain. It can mimic a lot of the symptoms of navicular disease. That's going to be, your frog width ratio is going to be small as compared to the length of the whole foot. All right, another big one that I've seen a handful of times is called sheared heels. So where those heels will actually be different heights. One side will be a lot taller than the other side. This can cause a lot of heel pain. We can go into the biomechanics of that more if you guys are interested. Let me know. But that definitely is a big cause of heel pain. This one's probably the most common one that I've seen, and that's just frog infections in general. The frog should be in a healthy foot. It should be touching the ground. So when that foot makes ground contact on a surface that is not, super hard, there should be at least some level of weight being taken by the frog. It should have ground contact. If there's not, like you can see on the picture on the left there, that frog is, inches above the ground when that foot's on the ground. That frog's not making contact. It can lead to frog atrophy and or infections. So another common one is this crack down the middle. This foot on the right looks healthy. The frog is wide, it's flat, it's full, it's relatively thick, but there was a huge crack down the middle. And if you put something like a Q-tip or whatever into that crack, generally the horse is going to flinch because it hurts, and it's going to feel like pudding underneath. Like it's just going to be incredibly soft. So treating that frog infection a lot of times will clear up what, a vet misdiagnosed, or anybody, not to dig on vets, but somebody misdiagnosed as navicular disease. That's probably the most common. I have repeatedly had clients spend hundreds of dollars on vet visits and x-rays to have their horse diagnosed with navicular, only to be told that they literally needed about $10 of thrush medication applied for a couple weeks and the horse is fine. So that's a big one. This one is a little bit more complicated. We could talk about this in a different video too if anybody's interested, but just having an underdeveloped, that digital cushion that's supposed to bear the weight on the back half of the hoof. So we can talk about different ways to identify that, but the best cross-section there shows the difference between like a healthy looking, thick, full, properly developed digital cushion that's really bearing a lot of that horse's weight as they're standing, and one that never had a chance to develop properly. Unfortunately, this is not something that, if your horse is over a few years old, is a very easy thing to fix. So that is a little bit more of a downer, but it is something that causes a lot of heel pain in horses at times. One red flag for this is, like this picture on the right is showing in black and white, a frog that's not touching the ground. And this picture also demonstrates a way to just evaluate if that frog is going to be touching the ground or not. You can lay anything flat, a rasp or whatever, on the back half of that foot and then use a ruler to sort of measure how far up into the foot that frog begins. If it's more than, half an inch, it's probably too far. You can also physically sort of wrap your fingers around that digital cushion as shown in the picture on the left here and sort of evaluate how thick it is. Again, I can show you this all if you would like to see it in real life, in real time, but here's just some pictures, some examples for you.